Okay, welcome everyone to Friday here in the fall. It is my pleasure to introduce today's speaker, who will be speaking to us on microaggressions, why words matter. A little bit about Dr. Nina Kuei. Dr. Kuei was born and raised in the South. And Dr. Kuei attended the Medical College of Georgia as an Atlanta native, and then moved across the country to Grand Rapids, Michigan, to complete a pediatric residency at Helen DeVos Children's Hospital. Dr. Kuei is currently a second-year developmental behavioral pediatrics fellow in Cleveland, Ohio, at the Rainbow Babies and Children's Hospital. I am delighted to have Dr. Kuei here, and this topic is one that is one of the most requested that I see across our health science system. And so I'm grateful that we'll be able to have an opportunity to learn from Dr. Kuei today. I'll turn it over.
Thank you, Dr. Smart, for that lovely introduction. Let me see if I can get my screen shared. All right. Okay, are you guys able to see that okay?
Yeah, looks great.
Excellent, okay. So, thanks for having me. Microaggressions is really a long-term passion project of mine, really stemming from my residency program where we didn't even have a DEI committee within our pediatrics residency. We had an overall one for the system, but not one for us, and which was problematic because we were trying to recruit and really diversify our actual amount of providers and what we were able to see and learn. So out of that came this passion project of mine. And in addition to doing research at Helen DeVos and continuing at Rainbow Babies, which I'll get to later, I've also talked on this on a national platform on Pediatric Meltdown with Dr. Leah Gagino, who does really fabulous work on psychiatric and behavioral concerns. And this is geared toward the provider as well as patients as well. So if you ever get a chance to check that out and series out, it's on Spotify and all the places you would find podcasts. So, all right. So no financial disclosures. It's just a picture of Helen DeVos and the Rainbow Babies, where I'm at now. And so what is a microaggression? Why is this such an important keyword that really kind of came out of the pandemic and when there was a lot of racial upheaval happening in the United States and overseas? So the definition, and this was coined by Dr. Chester Pierce in 1970, and then really brought back to light and expanded upon by Dr. Daryl Wing Su later on in the 80s and early 90s. But there's seemingly small slice that, whether intentional or not, they communicate some type of bias towards another group or person. So typically a marginalized group. This can be verbal, behavioral, environmental. They often happen daily without any recognition or confrontation because honestly, some people don't socially realize that this is a problem, or that they're just simply uncomfortable, which is kind of like the response I usually get these days. That it's just uncomfortable. People realize it's wrong, but they just don't want to get involved. And so we'll talk a little bit more about that later. But it can be really difficult to expose because sometimes people are well-meaning, they don't mean it in a negative fashion, and they often come cloaked in some type of supposed compliment or jokes. Why is this an issue, right? Everyone has to deal with this. Everyone's committed it at some point in time. But overall, to a victim, and especially of a marginalized group, they're getting this multiple times, even daily, on a yearly basis. And over time, that has a cumulative effect on their psyche, a negative one. So that ties really closely into something like imposter syndrome, basically being told that you don't belong, that you are othered always, every day, multiple times a day in different ways, shapes, or forms. And so this is a study based off of the Gallup poll. This happened in about mid-2020, but they looked at different adults from racial backgrounds and their experience with microaggressions over the past 12 months and looking at day-to-day life interactions. So they ask questions that do people act like they're better than you, or do they think you're not intelligent? Are you treated less than compared to others? What was their service like towards you? And far and away from everyone else were Black adults with people acting better than you. Almost a third of them said yes very often. What's so concerning. So think about, like, you have friends, family members. 1 out of every 3 almost experience this at some point. Then followed by Hispanics, then Asian adults, and then at the very last portion would be white adults. And this is striking because this actual Gallup poll is given in English. So these are only people that are comfortable with the English language, have English fluency reporting this. So this number in reality is most likely much higher if we were to count other people that may not be English natives. And in terms of microaggressions, they are highly tied into stereotypes and implicit bias. So we know stereotypes, they're characteristics attributed to specific groups of people that may or may not be true. Implicit bias is those subconscious attitudes, perceptions, and stereotypes that really influence our understanding and how we act and how we behave towards other people. And again, this is also highly tied into a concept called intersectionality, meaning that if you are a part of any type of marginalized groups, you may be a multiple of that. So for example, for say, a white woman compared to a transgender Black woman would be a really great example. So being part of the LGBTQ community, as well as being a Black minority, as well as being a gender minority as a female. And there are 3 subclassifications of microaggressions. The first one is a microassault, and this is the most overt, the most explicit. It can be racial, but it's a derogation characterized primarily by a verbal or nonverbal attack. It's meant to hurt. It is meant to be malicious. So it's name calling, avoidant behavior, or purposeful discriminatory action. So some examples would be using derogatory terms or racial epithets, colored, oriental, the N-word, for gay men, the F-word. Overt displays such as swastikas, preferential treatment, for example, deliberately serving a white customer for a person of color, is most likely to be conscious and deliberate out of all of the classifications. And it's usually expressed in a limited or private setting without a lot of witnesses because the perpetrator usually knows they're being a malicious person and they want to be anonymous, right? Because they know this is wrong. A micro insult is communication that conveys some type of rudeness, insensitivity. It demeans a person's racial or cultural heritage or identity. And so, for example, an employer saying, I believe the most qualified person should get the job regardless of race. Or an employee of color being asked, how did you get your job? Or are you the diversity hire? Are you the affirmative action hire? Or non-verbally. So if you're a teacher in a classroom, not acknowledging the students of marginalized groups. And this is usually unknown to the perpetrator. They're usually not meaning to be insensitive or rude. It's very subtle, but it clearly still conveys a hidden insulting message to the recipient that you are othered, or you are foreign, or you don't belong in this area. Micro-invalidation, that one's actually, I feel like it's the hardest out of all of them. Because people are really well-meaning when they're doing this. They're usually trying to give a compliment. So these are communications that exclude, negate, or nullify the psychological thoughts, feelings, or some type of experience of a person of color or from an identity. So for example, telling an Asian person or a person whose English is not their native language, your English is perfect. Well, they may have been born in America and have grown up here their entire life. They may not even have another language. Or where are you really from? That's one that I get quite a bit. So like, are you asking where I'm born, or like nationality, or I don't see color, or I have lots of Black friends, or I have lots of gay friends. And so the problem with that is that really negates the American heritage, and it conveys that these people are from another, they are perpetual foreigners. It negates and nullifies their personal experiences and feelings as an identity or as a culture themselves. And again, usually the perpetrator is actually trying to be very well-meaning, and often trying to give a compliment, and they just don't know that they're being demeaning and they're not realizing it. So I wanted to go through a few different examples with some focus topics. So the first one would be racial or ethnic bias. So being an alien in one's land, we've kind of talked about this before, but like, your English is really good, or what are you? You look so exotic. So basically exotifying, fetishizing a person from another ethnic or racial identity, and actually showing that you're not a true American, you really don't belong here, and that you're a perpetual foreigner, even though you may have grown up in America your entire life. Color blindness. So when I look at you, I don't see color. There's only one race, the human race. America's a melting pot. And the problem with that is that you're still forcing people to assimilate to the dominant culture, the dominant narrative, which in America is white supremacy, because our societal norms, our societal culture is really heavily based on white Western European culture. And so because of that, you're really denying the significance of a person's experience in their actual individual history. Criminality would be an example of if a Black person is shopping in Target and the store owner or loss prevention is following them, or going to the other side of the street to avoid a person of color, or checking your purse or checking your wallet when a person from a Black or Latino background is approaching. So, meaning that you are of a lower socioeconomic status, you are poor, you do not belong here, you're a criminal, you must be innately dangerous because of that. And then pathologizing cultural values or communication styles. So again, this ties really highly into the dominant narrative concept that individuality and being very outspoken is really valued here in America. So for example, to an Asian or a Latino or Native American, being told, why are you so quiet? We want to know what you think. Be more verbal, speak up more. And this really transcends just microaggressions in terms of day-to-day experience. This actually translates into Harvard admission offices. For example, in 2015, they gave Asian Americans a lowest assigned personality ratings in terms of admissions. So compared to all other groups, and that translates into something called the bamboo ceiling. This is based off the diversity report in Silicon Valley, 2015. And it was at the 5 biggest tech firms. So at the time that was Google, that was HP, that was Intel, LinkedIn, Yahoo, and it showed that Asians and Pacific Islanders were well represented in the lower level position, meaning that they're very subservient, they're diminutive, they will do as they're told. So good workers, but really bad leaders because they're not outspoken enough, they're not divisive enough. And so it showed that they were underrepresented at the management and executive levels. So this also translates to, say, a Black person who is very ingrained in their culture and likes to be themselves. So why do you have to be so loud? Why do you have to be so animated? Calm down. So telling people that you have to assimilate the white European culture, that you need to leave whatever cultural baggage you have at the door in order to fit in. Then in terms of sex and gender bias, so traditional gender role prejudicing and stereotyping, I think especially a lot of female professional colleagues have experienced this in some way or shape or form. As a physician, I get a lot of, are you the nurse? Are you the PA? That sort of thing. Sometimes I get, are you the interpreter? But understanding that a doctor is a male role versus a female role. And then also in terms of this, if you're a female in engineering or STEM at all, that's different. And that's really dominated by men, and maybe women shouldn't belong into that field. There's a lot of discussion these days about the tech field, about how male dominated it is. And in some organizations that there is a lot of microaggressions or even macroaggressions towards females that are there who are the minority. Another example would be when a really feminine woman turns out to be a lesbian and a person is surprised and they're like, oh, you're too pretty to be gay or something like that. Another one that's very common in multiple industries across the board, but when a female leader is very assertive, they're considered a B word. They're considered in a negative aspect versus a male counterpart could be very aggressive, very assertive, and they are great forceful leaders, usually what people will say. Ascription of intelligence. So basically telling a person they're a credit to their race because they're so intelligent, so eloquently spoken, or saying to an Asian person, you must be really good at math, right? Automatically. Or to a woman, oh, I never would have guessed you're a scientist or a doctor or a psychologist or anything like that. So saying that intelligence is really ruled by gender and race. Sexist and heterosexist language. So this really affects a lot of women and our LGBTQ counterparts. So using the pronoun he to refer of all people. So that makes the male experience universal, but the female experience is negligible. It doesn't exist. Being told that oh, we're only women, or being forced to choose male or female when completing basic forms, so not recognizing LGBTQ categories at all, or looking at relationship status as just married or single, showing that those partnerships are completely invisible if they're not typical. Or even looking at terms like names that we're calling people or classifications that we're calling people. So, for example, if a heterosexual man who hangs out with a lot of female friends, he's automatically considered gay or feminine. So, meaning that you must fit into the alpha male stereotype. Otherwise, you are inferior. So, what do you do? So, these are really uncomfortable situations. We all know that. And it's really easy to just ignore it and move on. But why do we not do that? We don't do that because this really affects the receiver. Again, this is cumulative. And when there's no recognition and there's no discussion, it allows the cycle to perpetuate. It upholds these societal norms that are not okay. And it further isolates people that are from marginalized groups. So for every microaggression, there are three parties. There's a committer, there's a receiver, and there's a witness. In terms of committers, so this is one of the worst situations, right? Because you didn't mean to say it, you probably didn't even realize what you were saying, and you're really scared of being villainized, right? So that guy on the left with all the fingers pointing. You don't want to be outed as a person who's just like a horrible individual, and you feel bad, and you just want to make it go away. The biggest thing is to stop, waiting, calming down, and then listening. The first thing we always want to do is go on the offensive and explain our intent and say, I didn't mean it that way. This is what I meant. But it's much more important to not even do that and understand and validate how what you said or what you did was experienced by the receiver. Being really open to and reflecting on that feedback. You know, this is a learning process. And the thing is, this isn't about isolating any particular person because we've all been in these shoes and we all have made comments. Even me as a person who tries to be really knowledgeable, every time, sometimes it slips. Sometimes I'll have a training and say, oh, like, where are you from? Like, yeah. Instead of saying like, oh, what's your background? Or like, where did you train at? It happens, right? Taking responsibility. And then there's a response framework that I really like in this situation. And when you're in this seat is CPR. So C is calm yourself. So taking that deep breath, collecting your thoughts, don't be defensive. And then remembering that this is a lot scarier than it really is because we've all done this. We've all been in this seat. He is practicing humility. So elevating the harm that you cause, how that person felt, what that person experienced over your own comfort. So kind of putting that ego to the side, taking responsibility, focus on the impact of the words, not the intent itself. And then repair is the last one. This is the hardest one because people really want to put a Band-Aid on what they did, right? People want to backtrack and make it not happen, but we can't do that. Centering the relationship. It's not your feelings or your reputation. So putting that ego to the side and learning. Asking what you can do. How can you be helpful? And accepting that repairing that relationship may take time. It is not the receiver's responsibility to educate you. That is, the onus is on you to do that. And knowing that even if you make an apology, you know, maybe that person's not in the headspace to accept that apology just yet. Maybe they're not in the headspace to talk about it just yet. So understanding that you're starting a process, you're taking the first steps, and it will take time. Then if you're the receivers, you're probably going to feel like that guy on the left right there, like mind blown, embarrassed, upset, frustrated, angry. But the big thing is taking a deep breath, preventing a rash reaction, especially in a work environment when there are real consequences to rash reactions, right? Thinking calmly about your next step. And most importantly, don't internalize. So if you can immediately counter the microaggression, either internally or externally, go for it. That's highly dependent on your situation, on your personality, and with the very real consideration that if this is a work situation, there could be some negative effects in doing so, depending on how your environment is. For example, if someone suggests that, let's say, an engineering job would not be a good fit for a woman, even if it's just in your own mind, giving yourself a micro affirmation saying, I don't agree with that. I think I can get that job. I'm going to apply for it. That's going to have a positive impact on your brain and it protects you from the microaggression. We'll talk a little bit more about microaggressions and why they work later. Using I statements if you choose to talk to the committer, and that's really brave and it takes a lot of courage to do this. But coming at them in a way to where they're not going to be as defensive. Because again, the committer may not have realized what they said. For example, I understand you meant blank, but from my perspective, this is what I experienced it as, would be a really great way to say it. So combating microaggressions as a receiver. So we talked about microaffirmations. So these are the direct opposite of microaggressions. So small positive thoughts that are really uplifting. And so this really turns into more of a topic called empathic joy versus empathic sorrow. So empathy, a lot of times to marginalized groups, is in a very negative fashion. Like they suffered this, like they are at a disparity because of this or that. Empathic joy is really noticing that there's a difference. However, making it positive. So like embracing other people's cultures, embracing people's individuality, embracing their experiences. And so there's a study by Patinsky et al. He was a Harvard psychologist. He coined a phrase that we're going to talk about in a little bit, but they did a year-long study that looked at a little over 1,200 predominantly white teachers. And they had these teachers who had predominantly ethnic minority students in their classrooms to utilize empathic joy. So really celebrating people's cultural differences, celebrating people's individuality, versus making them all conform in a certain societal norm. And what they found is that not only did they have better student outcomes, they had increased proactivity with the students, amongst the students, and positive interactions as well, just a better classroom in general. And then they also increased allophilia. So this is a term coined by Patinsky. It's Greek for love for the other. So basically showing empathy for an outside group, a group that is different from you. And Patinsky actually coined this because he was trying to find an antonym, an opposite word for prejudice, and he couldn't find one. So he made a word, allophilia. And again, just like microaggressions are cumulative over days and years, microaffirmations are exactly the same, but in the opposite positive way. So small actions create a really big impact. And then finally, probably the most important role, which people don't realize is the most important, is being a witness. So speaking up to validate a receiver's experience. If you are in a comfortable position to do this. Now, granted, fully aware that in some clinical spaces, some work environments, this may not be an ideal thing to do. You may be putting your job at risk. You may be putting your social standing at risk. It's understandable. But doing as much as you can to address the microaggression, recognizing the microaggression, and especially if you're part of the privileged group. So for example, if you are in most of mainland America, that would be a white male, right? However, keeping in mind that environments change depending on where you are. I actually have a friend of mine who's a white male that grew up in Hawaii, in Honolulu. And growing up, he was not the minority. The minority were Asian Americans, Pacific Islanders, and he was actually bullied and physically assaulted multiple times because of that. But just knowing that whatever the privileged group is in this environment, in this little bubble, being able to address that microaggression because you have that elevated ability to do so. Being an upstander, not a bystander. This is something we teach a lot of kids in classes. See something, say something. But this also is also an easy way to act as a witness in a situation. And I love this quote from Elie Wiesel, which of course he wrote Night, which talked about his experiences as a Jewish prisoner in Auschwitz. What hurts the victim most is not the cruelty of the oppressor, but the silence of the bystander. So obviously extreme example, but microaggressions act in the same way. And if we don't uphold the societal standards that this is not acceptable anymore. This maybe had been acceptable 30 years ago, but no longer acceptable now. It will continue in whatever environment this is. All right. And then this is a basic framework that I really introduced everyone on how to address a microaggression, because it's great to recognize these things, but then like when it comes to actually doing it, like how should I do this? It's all uncomfortable. So this is a great way in terms of just being able to delineate all the rules and making yourself available. So first thing is acknowledging the microaggression. So demonstrating awareness and consideration of the situation itself. Then secondly, validating the negative feelings from situations, and that supports those who are affected, and it also removes that cognitive burden of analyzing validity. The reason why there's a cumulative effect is because victims, receivers of this, are constantly worried about, am I being sensitive? Am I taking this out of proportion? Maybe this person didn't really mean this. And so they use a lot of mental energy and time outside of just the initial situation. Like this could play for them daily, yearly, weekly. They could think about it years down the line and wondering, was this even a problem? Like, am I not just being a typical person? Am I a troublemaker? And that ties a lot into the whole terminology of gaslighting and of people kind of shushing them and making them feel like it's not a big deal, you're overreacting. 3, confronting the microaggressive language. So that establishes that there's absolutely no place and no acceptance for this type of interaction. 4 is making yourself available to anyone affected by the situation. And this demonstrates a level of seriousness and that the receiver's feelings are important, that you are not going to leave those unanswered. And then 5, meeting privately with a microaggression committer. So again, making sure that you're not automatically putting them in a defensive state, especially within a group setting where they feel like, kind of like that picture I showed you earlier, the guy, everyone pointing at him, which is going to like really lead to embarrassment. They're not really going to be able to listen to what they're saying or what is being said to them, and to learn how to be better. So this optimally supports the committer's understandings about the harmful language or actions, and then without isolating from the group or promoting any type of resentful feelings or reactions for being called out. And then the perceived aggressor, again, may have only had good intentions. And again, I love this quote: leaving microaggressions unaddressed can have as much of a negative impact as a microaggression of itself on the receiver. So my work really circled around normalizing this conversation. I performed a 2020 needs assessment at Helen DeVos that showed 75% of the pediatric residents reviewed the topic as important, but only 10% felt very comfortable with identifying microaggressions. So like, not even sure if they're really realizing what's happening in a situation where you may have 20 people around a patient talking about all the things we need to do, and then a situation happens and you may not realize. And to give you kind of a scope of this, there was about 60 residents. So within that time, again, like I said, there was no formal education on microaggressions within the program or even within general medical education at home. And so what we had them do is we had both residents and attending pediatric physicians complete a pre and post survey, very simple one. It had 3 knowledge-based questions with discrete correct answers and 3 comfort level questions with a Likert scale. And we only did a 30-minute intervention that basically went over a lot of what we just did, but shortened quite a bit, talking about subclasses and classifications and examples of microaggressions. And we also did an open discussion where people could talk about their experiences and how they reacted, or did they not react, and how do they feel about that. And what we found was that in terms of knowledge, it was hard because there's definitions. So pre-survey was 51%, post-survey a little more increase, 57%. But the confidence changes pre and post-survey were the most striking. So in terms of responding as an aggressor, we had pre-survey, the vast majority 3 confidence level or below, so 53% at 3. Very few at very confident. And then post-survey, we had nothing below a 3. Then with confidence as responding as a receiver, pre-survey, again, almost everybody below 3. And then post-survey, 3 and above again. And then confidence responding as a witness, actually nobody answered 5, very confident on this. Everything, again, was mostly 3 and below. And again, post-survey, 3 and above for everything, with almost a 4th saying very confident at this point. So demonstrating that we were able to give people a toolkit and give examples on how to do these things and increase their confidence levels. just because there's simply not enough education about it. There's not enough guidance about it. In terms of gender and population group, gender identity, it was about 2 to 1 female versus male for both pre and post. And then for population groups, overwhelming amount, about 2/3 are Caucasian, which, I mean, if anybody's been to Grand Rapids, Michigan, it's very predominantly white, specifically Calvinist Dutch, and that's just kind of what the city's been built on. So it's not surprising. And then in terms of level of training, we got some disparity in the actual responsive levels. So about 40% interns, which dropped to 25% interns post-survey, almost 2/3 PGY2 and above, so past their first year of training. And then a little bit of attendings on each one. And most of that was because of the difficulty with, as you know, with all these survey type of studies, it's hard to get that return back, right? And so we're currently replicating this study at Rainbow Babies with the pediatric residents via the advocacy verification, with an addition of a 6-month follow-up and a 12-month follow-up, because I'll have more time for cycles here. And what we saw out of this data set was that it is beneficial for providers, especially with increased comfort levels, by giving them a toolkit and giving them definitions and examples so they can recognize this in the workplace, or even just in outside life. And then further discussion would include like workshops providing simulated practice, just like we do for simulating practice with patients. Could provide further education. Also, really keying in on specific interpersonal interactions could be explored with the response frameworks proposed for that. So for example, the clinical medicine hierarchy, so including like attendings versus trainees versus other specialists such as PhDs, nurses, techs. And then even looking at the patient-provider relationships. What do we do when we have this interpersonal relationship that really relies on long-term visits, and we're having microaggressions in ways from either the provider or from the patient? And then also exploring provider populations with increasing diversity. So how does that change confidence level? How does that change knowledge level? And looking at how those may affect how people respond as well. All right, I think I actually finished a bit early.
That's great though, because this is a topic that I think warrants lots of opportunity for discussion. Thank you very much, Dr. Kuei. Many of the things that you shared resonated with me, and I'm sure with many on the Zoom today. Thank you everybody for joining us today, and I'm very grateful again, Dr. Kuei, for your presentation. So thank you.
Okay, thank you everybody. I hope you have a wonderful Friday.